So the purpose of this short video is to introduce the HeartStart XL as an AED for use during cardiac arrest scenarios in the simulation suite. The HeartStart XL is a live defibrillator delivering a live shock. So when in use during scenarios, it is important that you adhere to all of your safety measures as outlined in your BLS provider's course. The HeartStart XL is stored on top of the emergency trolleys. In the CSSRC, these are all stored outside of the simulation rooms, and it's always plugged in when not in use. Before use, it's very important that it's removed from its power source and also before movement. There are 3 buttons labelled 1, 2 and 3 on the HeartStart XL. Button 1 controls power and mode selection. The HeartStart XL can be used in both manual and AED modes. Certified BLS providers must always use AED mode. Button 2 is the analysis button. When the pads are attached, an arrow pointing to button 2 will appear on the screen. The first analysis occurs automatically. The AED operator must follow the prompts and clear the patient. The AED operator must press button 2 for subsequent analysis. Button 3 is the shock button. If a shock is required, the AED will take a few seconds to charge. The AED operator must ensure that the patient and the area are clear before pressing button 3. After a shock, the AHA BLS algorithm requires providers to give 2 minutes of CPR before reanalysing the rhythm. The pause option will appear above the button with the white dot. Within 10 seconds of a shock being delivered, the AED operator must press the button with the white dot to activate the 2-minute timer. Okay, so we're going to head in now to the cardiac arrest situation. The simulated pads for the mannequin differ from the defibrillation pads used in real rescue situations. In the simulation suite, we use button connectors that attach directly to the defibrillation studs on the mannequin's chest. These studs are located in the anatomical positions where you ordinarily apply the gel pads. One on the right of the patient's sternum, just below the clavicle. The second on the lower left side of the chest along the anterior axillary line. These studs are clearly visible on the mannequin's chest, while the cardiac monitoring studs are hidden under flaps. When 2 rescuers are present, compressions should continue while the connectors are being attached. On arrival to the arrest situation, firstly turn on the AED and follow the prompts. Connect the pads to the AED and attach to the mannequin. Take care not to interrupt compressions. When prompted by the AED, clear the patient and the bed for analysis. If a shock is indicated, the AED will begin charging. Once charged, again clear the patient and the bed before shocking. Ensure you are looking at the patient and ensure all present are clear before you deliver the shock. After the shock, once the pause option is available on the AED, press this and the 2-minute timer will begin. Compressions should begin within 10 seconds after the shock is delivered. If 2 or more rescuers are present, continue compressions at a ratio of 30 to 2 ventilations. Remove the back of the bed and store safely to avoid it becoming a trip hazard. Deliver ventilations using a bag mask device attached to oxygen with the flow meter at 15 litres. Using a bag mask is a 2-person skill, and the person holding the mask must be behind the patient's head with 2 hands on the mask, maintaining a seal and keeping the airway open. The compressing rescuer should squeeze the bag just enough to achieve chest rise, delivering each ventilation over 1 second. Compressions should recommence within 10 seconds and cycles of 30 to 2 continue until the AED sounds that 2 minutes has elapsed. Then the person operating the AED clears the patient and the bed as before and presses 2 on the AED for analysis.
Everybody clear, stay clear.
Shock delivered.
During analysis, team members not operating the AED should swap roles so that a different rescuer is ready to take over compressions immediately once indicated by the AED. Before participating in simulation, review the team dynamics element of basic life support. As American Heart Association and Irish Heart Foundation certified BLS providers, you are trained to provide care to persons in cardiac arrest. This care includes providing high-quality compressions, defibrillation when indicated by an AED, and ventilations with a bag mask. It is advisable to review the content of your HeartCode BLS programme on the online training platform, and the American Heart Association cardiac arrest algorithms are available on Canvas. Finally, to reiterate, the HeartStart XL used in the simulation suite is a real AED, delivering a live shock. If you are the AED operator during a simulation, ensure you verbally, visually and effectively clear the patient and the bed as prompted by the AED, both for analysis and for shocking. Further resources relevant to your upcoming simulations are available on Canvas.